Hi, I'm Maisie, and welcome to today's episode of Public Health Spotlights. Today, we're joined by Director of Public Health at Solihull Council, Ruth Tennant. So, welcome, Ruth. Are you able just to give us like a brief overview of your journey to becoming a Director of Public Health?
Yeah, of course. So I've probably got quite an unusual background in that I started off in public policy jobs. So I worked at the European Parliament. I then went to an organisation called the Audit Commission, and then worked at the King's Fund. And I was at a point of thinking, I really want to train for something. So I haven't got a background like in medicine or environmental health like some colleagues. And I was about to actually go and do graduate entry medical school. And at that point, they were just opening up places on public health training to people without medical backgrounds. And I read an advert for this and thought, actually, this sounds like it really floats my boat. So went and did the public health training scheme. And then I've worked in various roles in the NHS and local government ever since then.
Nice. And what is the role of being a Director of Public Health to you?
So for me, it's really about thinking long term and thinking broadly about what it is to keep the population fit and healthy. So how do we get the maximum health gains for people in our local areas? So really broad, and obviously there's lots of different aspects of the role that fit within that.
Okay. And why did you choose Solihull?
So Solihull was my second Director of Public Health job. So my first one was in Leicester. So very different role, big urban multicultural city. Absolutely love working there.
Yeah.
Solihull was a very different challenge. So Solihull has one of the biggest gaps in life expectancy. So it has a very affluent south of the borough and a very deprived north of the borough. So real challenge in terms of tackling inequalities and closing that health gap. And for me also, it was a real contrast coming to an area that is a big economic player as well. So Solihull has Birmingham Airport, it has the National Exhibition Centre, it has some really, really big employers. And for me, really different challenge. What does it mean doing public health where you've got a major international airport, where you've got very big workplaces, where actually a lot of the kind of big goals are around economic growth. So two almost directly contrasting roles, but I've loved both of them. And I think that's the great thing about public health. It looks different in different places and it will mean different things to different people doing the job.
What would you say one of the most rewarding experiences of being a DPH so far, or perhaps like the biggest challenge for you has been?
So I've been a DPH now for getting on for 10 years nearly. So lots of career highlights. So I'm just thinking when I was in Leicester, we opened the first city centre sexual health clinic. So a big clinic right in the middle of a shopping centre. Real challenge, absolutely fascinating piece of work. Loads of things that we had to get through to get to that point. But when you finally get something like that over the line and realise how much it improves accessibility, gets people through the door, really, really satisfying. And then more recently, we have led on setting up new family hubs. So we've got 3 hubs that have gone live over the last couple of months. So for me, some of that really practical public health where you can actually see transformational change in how we do some of our services. And you can see that on the ground and it's going into places that need it. For me, I get a real buzz out of that. Cool. I think another highlight for me, again, work closely with the airport and I'm responsible for emergency planning. And we had Sudanese repatriation flights coming in where we very quickly had to set up rest centres and just seeing people coming through from really, really extreme situations and knowing that we had a response that were looking at their health needs, providing kids with colouring, giving adults mobile phones. So really kind of dealing with real kind of crisis frontline stuff and just seeing the difference that you can make really quickly. So very different kind of scenario. But again, many directors of public health will have that emergency planning response as part of their portfolio and some, really big knotty challenges, but where you really see multi-agency responses kick into play.
Nice. And I guess from that, is there any sort of a skill that you wish you'd developed more before becoming a Director of Public Health that could have perhaps helped you with some of those challenges?
Yeah, really good question. So We're all trained as public health professionals. We come in with technical skills. We know all about statistics. We know all about numbers. We know all about evidence. But actually, as a director, quite often your big job is to use all those things, but to kind of really drive change. And for me, that's about having amazing influencing skills, getting to know people from a range of backgrounds, because that's how you need to really do public health. And I think the sooner people learn how to that really important human dimension of the role, it stands you in really good stead to be able to do the job well. We're often working with really quite small teams, so
Yeah.
a lot of what we get done is done by influencing other people who may often have better skills than you've got for the area you want to change. So, really focusing on how do I deliver change in lots of different organisations and lots of places. So I think that's the one big thing I think everybody needs to do the job well and to grow into the role as well.
So as well as being a DPH, you've also got some oversight of some of the children's services. What particular services are they?
Yes, that's right. So I'm currently, and a lot of directors
Yeah.
of public health will have other responsibilities as parts of that role, particularly as you kind of grow
Yeah.
experience over time. So I've currently got responsibility for education and inclusion. So that
Okay.
includes a lot of work with special educational needs, so children who need kind of extra help, extra support.
Okay. And is there any sort of particular advantage that that gives you, having oversight of those services?
So I think one of the key things for me that in public health, you get used to having to work across lots of different agencies and organisations. So education, you're working very closely with schools, but actually if you're looking at the needs of children with special educational needs, you're looking at what the NHS does, you're looking at what schools are doing, you're looking at what services the council provides. So it's really going back to some of those principles about, well, what are the needs in these communities and these with these children, and what do we all collectively need to do to improve that? So quite often there are transferable skills. So I'm not an expert in education, I'm not an expert in special educational needs, but I think you bring that ability to say, what are the needs of this group in the place I work, and how do we all work together to improve that?
And is there any sort of particular tips that you could give to an aspiring director of public health regarding interviews?
So I think the key thing for me for any interview is really know why you're going for that job in particular. So know the place. I think it's really important that you understand what that place looks like. What is it about that area that attracts you? What are the health challenges? But what are the other kind of things that make you think, yes, that's the place I want to work? So really encourage people to do your homework, go and talk to people, drive around areas, just get a feel for that place and what you think you offer. Every DPH job is different. So I think it's really thinking yourselves into the shoes of what it would mean like to do it in that area, and doing that kind of preparation ahead of the interview.
Sure.
The other thing I would also say is really think about what role you think is right for you at your stage in your career. So it may well be that you want to do a DPH role that's got a broader portfolio. Inevitably, that means you might be working in areas you've not had a huge amount of expertise in, which can be a great thing. It can be a good challenge. But again, really think about for you, what are your skills? What do you bring? And is that the right role at the right time for you? So, as usual with interviews, do your homework, do your background, and really think, is it right for you? And are you right for them? And it's all got to be about the fit.
For somebody sort of looking to be in a DPH role, do you foresee any particular challenges or drivers in the future?
A lot of it, I think, will always come down to being flexible. We know that the public sector is changing, that we know we've got loads of needs out there. We're in a kind of fiscally difficult situation. So one of the key things is that ability to adapt and change, be able to kind of always go into that, what is it that I need to do here? You can't do everything in a DPH job and it will change. So I think adaptability and that ability to change as situations change is really, really important.
Okay, that's really, really helpful. And obviously, you're a member of the Association of Directors of Public Health. What does being a part of that network mean to you?
So, for me, personally and professionally, it's been a really, really helpful network. So I think what it brings is the ability to benefit from colleagues who might be in a similar situation to you or a different situation. So really good resource around mentoring, peer support that can be incredibly helpful. Everyone will go through difficult times in their career. So some of that wider support is really, really useful. There's also something about actually learning from other places. So a lot of what ADPH does is about learning what's going well, what's working in different areas, being able to pull that together and come up with a shared national voice. So I think it gives us collective strength, but also means that we're able to talk to government departments or talk to politicians about what public health does with the unique perspective from all the different parts of the country and all the different bits, all the different DSPH out there.
And is there any sort of one piece of final advice that you would give to an aspiring director of public health, or even somebody considering a career in public health?
So I think the one key thing for me is, and that's some very good advice I was given actually by a previous chief exec, who I said, I'm not quite sure if I'm ready to be director of public health. And he said to me, you're always going to be on a learning curve. Your first director job will always be a learning curve.
Yeah.
And for me, that was fantastically useful because I think you are never going to go into any job as a finished article. You develop, you learn, we all learn all the time. So I think it's okay to think there are things I haven't done before, skills I'd like to develop, and really go in with that kind of growth mindset of thinking, I will learn from colleagues, I will learn from peers, there will be things I will get wrong, there will be things I will get right, and that's all okay. So I think that would be my number one take home for people thinking about it. And I guess the second thing, it is a fantastic job. It's a demanding job, but it's a really rewarding job. And you know, definitely if you're thinking about it, again, talk to other people, but I'd certainly recommend it.
Thank you. And just one more final question. Obviously, director of public health is an amazing sort of senior post. What sort of next? I mean, where would you be planning on going after being a director of public health?
Yeah, really good question that. So in my head, there are a number of routes. So obviously every director of public health job is different. So as I've gone through my career, I've ended up with wider remits. So one route is, you know, to take on communities, or I know people who are now responsible for adult social care. So bringing that public health skill set, but kind of across a broader range of services. So that's certainly one route. I know there are really talented colleagues out there who I think in a couple of years' time will be chief executives in councils.
Yeah.
I know some people who've gone on to really senior clinical roles, so gone to integrated care boards. So I think, you know, you can always grow into different DPH roles, or there are other roles out there where your skills are incredibly useful. So I think it's, for some people, they want to be directors of public health for the rest of their career. Other people want to move on to something else. And I think that's one of the benefits of the job. I think there's more and more routes now beyond being a director of public health than there used to be. And again, that's really exciting for me.
To do public health, you've got to work with loads of different organisations. What would be some of the main ones that you work with?
Yeah, so for me, it's very specific to the piece of work you're working on. So I know at the moment we're doing quite a lot around work and health. So, for example, I've been working with our local Chamber of Commerce and some of our big local businesses. Obviously, relationships with the NHS are really, really important. And again, we work very closely, particularly with our local general practice, but also with the integrated care boards and some of the hospitals. Clearly, we work loads with different colleagues from right across the council. So again, adult social care, with children's social care, working with our economy and infrastructure colleagues who are doing lots around regeneration, growth, parks and planning. So it feels like every day you're working with a different group of people. And again, I think that's one of the exciting things about public health. You really do need to have those strong networks and really understand all the players in your local area to improve some of the public health outcomes.
Thanks so much for your time today, Ruth. I've really enjoyed speaking with you. And thanks everybody for listening.